According to new national polls of Canadians and family physicians, many Canadians don't realize addiction is a chronic medical condition that can cause physical changes in the brain. In fact, many Canadians continue to be misinformed about opioid addiction, believing willpower should be enough to quit using or that addiction can be avoided altogether. On the flip side, family physicians widely acknowledge that patients living with opioid addiction face considerable barriers to accessing treatment they need.
If you were to tell somebody about a chronic brain disease that's potentially fatal if untreated, most Canadians would be very surprised to hear you are actually talking about addiction. Many Canadians see addiction as self-inflicted, as though it's as simple as just saying no. In reality, addiction is a complex brain disorder. A person who's developed an opiate addiction will likely be affected for life. Like other chronic illnesses, addiction cannot be cured, but it can be successfully treated.
But according to new data, Canadians may not be as informed as they think. Nearly half of Canadians are unaware that opioid addiction is a chronic, relapsing brain disease, and 28% believe opioid addiction is a voluntary lifestyle choice. Over 200,000 Canadians are addicted to prescription painkillers, though given the lack of surveillance data combined with the stigma surrounding addiction, it is challenging to accurately track the disease and therefore the true prevalence is unknown. Vida, a mother of 2, became addicted to OxyContin after she was prescribed painkillers to deal with a herniated disc. The situation escalated very quickly as she became addicted and began seeking them out on the street.
Trying to get off of pain medication is very difficult on your own. I did try to stop on my own. The withdrawals were, sweating and vomiting and just feeling really sick, couldn't get out of bed. I tried and I would always go back just to try to get myself through the day. I had to take these pills. So I did try on my own, but with no success. I eventually got clean with the help of a doctor. I had to seek out medical attention. I was very lucky that I got in touch with a very understanding doctor who was able to help me with the withdrawals. And since then I've been helping others with their battles in addiction, mostly troubled teens. And it's been very rewarding being able to give back. But it's a very hard thing to do.
According to Dr. Boardman, no single factor can predict whether a person will become addicted to drugs like opioids. Risk for addiction is influenced by a combination of factors that include individual biology, genetics, social environment, exposure to the drug, and age or stage of development. The more risk factors an individual has, the greater the chance that taking drugs can lead to addiction.
Addiction knows no borders. It's an equal opportunity condition targeting Canadians in all walks of life, no matter their level of education, profession, or geographic location. It's important for Canadians battling opiate addiction to have access to the kinds of treatments they need to help them stop using, be it counseling, support, and if appropriate, medications.
According to the International Narcotics Control Board, Canadians have become the second largest consumers of prescription opioids worldwide. As a result, there is a significant demand for opioid dependency treatment in Canada. For example, in Ontario alone, the number of patients seeking treatment has doubled since 2005. Provincial and federal governments have responded differently to the growing problem of opioid addiction in Canada. Some provinces like Ontario are taking some steps to fund additional treatment of people addicted to opioids. But many efforts focus on drug crimes, punishment, and abstinence, like the federal government's National Anti-Drug Strategy, as opposed to providing treatment options or addiction support.
The good news is that opiate treatment options exist and have been proven to be effective. The other good news is that many Canadians have access to a family doctor who knows their medical history and may be able to treat and counsel patients battling addiction. This is a complex field, and in addition to supporting patients, we need to support family physicians with ongoing education, support, and mentoring in order for them to be effective in treating the growing number of opioid-dependent patients. Patients should not feel ashamed to come forward, but we also need to ensure that there are programs, treatment options, and physicians to help them.
Bottom line, experts say that addiction is an urgent public health issue in Canada and needs to be recognized as a chronic disease and treated as such. That means broader access to treatment programs and the implementation of evidence-based public health strategies by policymakers instead of just criminalization. Deborah Scott reporting.